What we're here today to talk about is the fact that I recently brought Adam Silberman to work with me here in the clinic, and he's a naturopath and I'm an allopath. So allopaths are doctors that have MD after their name, as most people know. But to have the two schools of medicine working together is not necessarily a normal offering that people are exposed to. So what I wanted to talk about today with Adam is just kind of like have you talk about what a naturopath does, just for those that don't know. And then maybe after you explain that, tell me what kind of patients you're excited to attract to this clinic so that we can work together on them, or you can work primarily and I and the other doctors in the clinic can lend our expertise to what you do.
Yeah, so naturopathic medicine is a specialty that focuses on looking at the body in what's considered a systems-based approach. So we certainly evaluate a patient's concerns in terms of what they're presenting with a symptom, be it stress, anxiety, fatigue. Maybe they have high cholesterol levels or their blood pressure is elevated. Maybe they have high blood sugar. But we think about that in terms of, okay, what are the underlying contributors to those symptoms? And how do we address those underlying contributors to then alleviate what they're coming with? A good example would be looking at someone's elevated blood sugar and talking to them about how not only nutrition, but also sleep, movement patterns, and stress management can play a role in that blood sugar level.
What types of patients are you most excited to work with, and where do you focus your attention mostly? I know you do a lot of things, but what's your area of interest?
Yeah, I like to focus primarily on working with individuals and families that already have some sort of understanding of what it is to be healthy. Maybe they're working on lifestyle and nutrition strategies already for themselves or in their home. Maybe they're looking to podcasts or books on longevity, anti-aging, or other health strategies, and they want a partner who can communicate with them and help them to evaluate those data sets and personalize them to what they're looking to achieve in their life. That could be a combination of lifestyle modification, advanced lab and biometric testing, including genetic interpretation, and then recommendations that could include medications, supplements, herbal medicine, diet, lifestyle, and also specialty care.
Do you use traditional allopathic type medicines that people have already heard of in your practice as well, or do you primarily focus on other things?
It's a good question. I am absolutely comfortable in prescribing and managing most of the typical medications that a patient can be put on by their primary care doctor, be it for their blood sugar, cholesterol, blood pressure, as well as hormones, testosterone, estrogen, thyroid hormone. Being a naturopathic doctor, I like to focus on what I call the foundational aspects of health. I like to focus on nutrition, sleep, lifestyle, mindfulness, and food, right? As a cornerstone for any type of therapy. And then given a patient's specific interests or goals, we'll use herbal medicine and supplementation, hormone therapies, and medications if needed. I like to try to keep patients on the minimal effective dose of medications as much as possible. So patients that are interested in managing their medication program can come to me and we can work together to keep them on what would be like a minimal effective dose by optimizing these other areas of their life.
You also have an area of interest in musculoskeletal health, so like aches and pains, joints, ligaments, that kind of thing. Talk about the things that you offer in that area.
So in working with a patient that has pain, I think this is one of the areas that we can work really well collaboratively. I've noticed in working with pain that there are certainly imbalances in a patient's foundations of health that then lead on to exacerbating their pain. That could be as simple as, helping with a weight management strategy to managing someone's knee pain. But it could also be poor sleep, not allowing the body to recover and heal, thereby exacerbating a pain syndrome. Additionally, I'm trained in what are called regenerative joint injections. These are injections that are intended to help the body to heal areas of injury, whether it's a strain of a tendon or ligament, a cartilage issue or a meniscal derangement, or otherwise. Many times, incorporating these injection therapies alongside foundations of health treatments, targeted supplementation, and specific nutrition and rehabilitation programs can be, the turning point in someone's pain. One of the reasons I'm excited about working here at the Howe Clinic is that we really take a focus as a group on using regenerative therapies as much as possible. And in doing so in an appropriate context. There can sometimes be this philosophy of what if you only have a hammer, everything's a nail, right? And that certainly is not the case here. The nice thing about working alongside Dr. Howe and the other physicians here is that we can take a really detailed and specific investigation and analysis of what's going on with you from a lot of different angles. And in doing so, we can really drill down into understanding and finding opportunities for support that are going to have a high probability of success, especially if done in combination.
Yeah, one of the reasons, the biggest reasons that I reached out to Adam to have him come onto our team was that when I do interventions or have done interventions on people in the past, so helping them with pinched nerves or torn ligaments or something like that, there's always there's a lot of variation in how well that goes, how well the outcomes show up with that. So people that are taking care of themselves, are nutritionally optimized, getting sleep, not super stressed out, they do better. I mean, intuitively, it makes sense. And I have some expertise in that, in what I call fertilizing the ground before we plant the flowers. I can do some optimization, but my focus is more on the musculoskeletal side of things and the mental health side of things. So that's one of the major reasons that I brought Dr. Silberman here to help my patients and provide options that I was unable to do by myself. Speaking generally about allopathic medicine and naturopathic medicine, there's a lot of things that allopathic medicine we do really well. We're good at acute things. If you have a stroke, a heart attack, if you've got a traumatic injury, we're really good at fixing that. The work that has been done in infectious disease over the last 100 years is one of the major reasons that this world is functioning the way it is, not good or bad, but it's sentinel what infectious disease does. But there's a lot of chronic stuff and a lot of kind of vague stuff that allopathic doctors, so MDs, we aren't well equipped to handle, and patients don't get great outcomes, and they don't feel as though what we have to offer as allopathic doctors is meeting their needs. To be able to, not that everything that Adam does or that naturopaths do are focused on those things, but a lot of the symptoms, just chronic fatigue and generalized pain and mental slowing and that kind of stuff. When you come into the ER, I'm an ER doctor, when you come in with that stuff, it's really challenging for me to think of anything I can really do to figure it out. I can tell you don't have a stroke, you don't have something big going on, but what I can actually do to move the needle to make your life better, not a lot. There are allopathic doctors that treat chronic disease that may have a better idea of what's happening. But in my experience, to have someone with Dr. Silberman's background or someone of similar training to him working to help try to figure those things out, that's invaluable. And then on the opposite end of the spectrum, you're talking about health being defined as lack of disease. But if we come over to the other side, health can also be defined as an optimized human doing what they love and having an amazing life. And that's extremely exciting for both of us. We want to work on that side. Now, you're going to start over here maybe, and we can bring you over to an optimized human. But to be able to reach out and work with somebody who is excited to participate in their own life, which is not everybody, able to see the value in having alternative therapies to what is normally available, and then to provide a suite of services that meet those needs, in addition to a place where they can go to say, hey, I read about this, or I'm wondering about this. I know that I heard a podcast about that. What do you think about this? Can this help what I'm going through? Bringing those expertise together in a place where the person can come and get the answers. That's one of the things that excites me the most. And to bring Dr. Silberman and the other providers that provide different services here together, that's kind of where we all gel and where we all meet in as far as a mission and a reason that we're doing things. So anyway, I hope you can tell I'm super excited that Dr. Silberman's working with us. And we've been doing good work for a couple years now, and we're just getting better as time goes on.